In this session. Today, we are joined by the main speaker, Dr. Jean Kassia, the Director General of Africa CDC, and we are also joined by Rwanda's Health Minister, Dr. Sabin Sanzimana. I will now hand it over to the DG to start the session. Over to you, DG.
Good morning, good afternoon, good evening to all of you. Today, we are taking this call, the Minister and myself from Jeddah, where we are attending the AMR meeting, antimicrobial resistance, the fourth high-level ministerial conference. And we hope that the minister's mic will be working because he has some issues. Otherwise, we'll find a solution for him to be connected. Welcome, Minister. Then,
thank you,
thank you. For your information, the minister just landed to Jeddah 30 minutes ago after flying for more than 24 hours. But because he's so committed for the response to our outbreaks in Africa, thank you, Minister, for your leadership and for your commitment. Let us start with the slides. I will start with Mpox, then we will have good news from the minister about Marburg. Let us go. Second slide, please. Mpox, as you can see, now we have 19 countries affected since 2 weeks ago. But what is new? You know that we had new cases in Zambia and Zimbabwe, and we are doing the genomic sequencing. Now we have the outcome. It's clade 1B. It means this 1B is now spreading everywhere in most regions in Africa. And we need to see what is concrete action that we need to take in addition to what we are doing to stop that. And for the past 6 weeks, we had 15 countries reporting cases. Next slide, please. And with this reporting, in total, we can say from week 1 to week 44, we have 53,900 cases and around 1,109 deaths. That is bringing, and so important, the case fatality rate at 9.9%. As we know, the case fatality rate for Mpox could be around 3%. Then when we are reaching around 10% of the case fatality rate, it's huge if we compare with the confirmed cases. And in total, if we compare 2024 to the entire 2023, we have an increase of 569% in confirmed cases. Only last week, we notified 2,836 new cases, with 461 confirmed. This 2,800 seems to become, for some weeks, the average, because we are between 2,500 to 3,000. And that one is sending us a clear message. You will see it in the conclusion from the emergency consultative group that Mpox is not under control in Africa. Next slide. We wanted to zoom in about Uganda, talking about Uganda. And you can see that the increase, if you compare previous weeks, you can start even the 31st or the 29th, you will see how Uganda have an increase. Just if you compare week 43 to week 44, we have an increase of 1,214% in confirmed cases. Only this week, Uganda recorded 184 new cases that are all confirmed and are all clade 1B. Even if the mortality in Uganda is not comparable to DRC, but we already recorded one death. And with this increase of numbers, we are trying to see if the government for Uganda, how we can accelerate with the response to stop this increase. Next slide. This is a slide we wanted to share with you because so many colleagues are asking why it takes too long for Africa to stop this outbreak. I wanted to remind that end of May, beginning of June, we started to see increase. And also, what colleagues maybe they don't realize, in June, there was the first attempt for WHO to declare Mpox as public health emergency of international concern. But some experts, they said we don't have enough evidence, and that one was delayed. This is why in July, when WHO Director General convened again the HR committee, they were not clear on the decision. It's the Director General who took the decision because the HR committee didn't give him clear guidance on if he has to declare or not. We believe that he was right to declare because you can see the trend from July to August. And it took almost 3 to 4 months to start to see the first decline. But this 3 to 4 months in Europe, it was thanks to huge vaccination campaign, to huge support in terms of medicines, tecovirimat, and also to the digital system to report all cases and to test 100% of notified cases. We are far from there in Africa. Our testing rate is still too low. We are far from there because our surveillance is still not at the level we're expecting to be. And we are also not there because we have a mix of so many other outbreaks. And we want our colleagues and our population to understand that fighting an outbreak is not a one-day issue. It can take time, especially in a continent where the health system is not strong enough. Next slide. We are celebrating good news. We have to say every day local manufacturing is what Africa decided to achieve very soon. Let us start to celebrate small success that we have, like this one. For the first time in Africa, we have our real-time PCR test kit that are manufactured by an African country. And this test was approved after a number of testing done in DRC to ensure that the clade 1B, this test was sensitive for the clade 1B and other clades. Africa CDC, AUDA NEPAD, Diagnostic Advisory Committee is recommending us not to use this test. And the emergency consultative group made a clear recommendation to request all African countries to start to use this test. And then we'll, as Africa CDC, work with FCFTA to ensure that this test can be procured and supplied to all African countries. Next slide. In terms of our vaccination campaign, we are making progress. Rwanda did a great job we are supplying additional vaccines to Rwanda. DRC did great job. We are supplying additional vaccines to DRC. Nigeria, they will start in 4 days. And we are following new countries affected and also other high-risk countries to see if we can start very soon. As you know, we have around 900,000 vaccines available now, part of the 5.6 million doses committed. We are still waiting for the 3 million doses from Japan, and we are in dialogue with Japan and other partners to see how these vaccines can land very quickly. More than that, we are working with biotech, and we are working with Bavaria Nordic for the tech transfer to ensure that very soon we can have also vaccines manufactured from Africa. Next slide. From Thursday to Friday last week, we have our experts from the Emergency Consultative Group who came together to analyze the situation on Mpox and Marburg. The conclusion was clear from our African experts supported by international experts that Mpox is not under control for now. And they are advising us if we can use this data to build a momentum around the future of this outbreak. And they also want us to take this opportunity, because the crisis can be opportunity, to build a decentralized testing system in Africa and to support the local manufacturing agenda while we are rebuilding and rethinking our health system. Our experts, they are commending Africa CDC and WHO plus other partners because we are using data and all evidence that we have to drive the agenda. And that one will become the motto in Africa for the future. Next slide. This is my last slide. It's about what we call, after Mpox, after COVID, there was a legacy. Now, what will be, what we consider in Africa CDC as the legacy after Mpox? The first one is not to have at national level, but at decentralized level, what we call the lab capacity strengthening. It means we will bring the qPCR from national level to provincial level or regional level. It means we'll bring the gen expert to all districts in Africa, and we'll continue to reinforce the capacity of countries at national level for the genomic sequencing. We are also thinking about the digital agenda. It's time for us to leverage on that. A few weeks ago, I was in Rwanda for the Digital Health Summit that we had there. And we are talking on how this digital health agenda can support the surveillance system in our countries. We are also talking about infection prevention control, how we can reinforce that by ensuring that a strong WASH component, it means water and sanitation and hygiene, will be implemented at all levels, at community level and school level, in addition to the local manufacturing agenda and the research and development agenda. These are the 5 pillars that we consider for now, in addition to the domestic financing, will be major legacies of Mpox. I will stop there and hand over to the minister through our director, Margaret. Over to you, Minister.
Thank you, Director General, Africa CDC, again for inviting Rwanda to be part of this weekly update on these outbreaks on the continent. As we've presented before, on September 27th, Rwanda declared the presence of Marburg virus disease for the first time. And since then, we've been fighting this virus to make sure it's controlled in Rwanda, but also it's controlled on the continent. It doesn't go beyond our borders. So I'm very happy to report here today that it has been 2 weeks, almost 2 weeks, without a case, and has been a month without a death related to Marburg virus disease. And all patients that were being treated for this virus have been discharged now more than a week. So we would say that this time we are making very good progress. Of course, we remain vigilant to make sure that surveillance on bats, especially fruit bats, as we earlier discussed here, that our index case was infected from fruit bats in a cave in Kigali and near Kigali capital, and that we actually expanded our surveillance to all caves across the country. And we are now monitoring the movements of these fruit bats with different technology, with different combination of teams from animal and human health, One Health framework. So we believe that it's an opportunity for us to expand our preparedness capabilities. But at the same time, as you understand, we have had 51 recoveries from 66 cases that were infected. So another continuous activity is to follow up on the survivors, those who recovered from this virus. The case fatality rate for those who did not make it has been maintained at 22.7%, which is relatively lower compared to previous outbreaks in the region. But we lost 15 lives, most of them in the first 2 weeks of this outbreak. And as we continue to deploy new tools, new therapeutics, vaccines, we've seen really good results that have led us to where we are today. So moving forward, this was really another call of action for all of us, that outbreaks and pathogens are always there, and anytime something can happen. So the best way to be prepared is to have strong systems that will detect diagnostics with tools that, for some viruses like Marburg and others, we don't have enough tools already in the market, but at least we had something to try and to see that we can save more lives and stop the spread of this virus. So this is a good step forward. It has helped us to revise a lot of things, including preparedness guidelines, infection prevention control. We are now conducting a number of trainings for those who are already on the front line, so that we continue to activate the team for any future outbreak. But as Director General of Africa CDC reported, we have Mpox in the region, which is also another active front where the same team is confronting Mpox in Rwanda, and we are making progress with vaccinations. And Mpox seem to be not yet under control for the continent, as DG explained. But if we continue to work together, because it has affected several countries, no single country will do it alone. It has to be a joint effort. So I would like to just give these highlights that Marburg outbreak in Rwanda is over. And what we're doing now is to strengthen our capacities, because always we have this, it's a test of the systems, how we're ready, how we collaborate, how we work together. And it brings a lot of scientific information that we keep providing also to the broader public health, global health, scientific communities, that we learn from it and we do better next time. So this is what I can say. For those who haven't been in previous outbreak briefs, we were able to trace this from a spillover from fruit bats. And this first case, the first person who got infected was working in the cave as a minor. Is still there. He didn't develop severe symptoms by that time, but unfortunately, his spouse and a newborn child lost life. These are first cases that happened to be treated in teaching hospitals in King Faisal Hospital in Kigali and the University Teaching Hospital of Kigali. In ICU departments where the staff attended them got also infected. So that is, in summary, how the outbreak started. And the numbers of who affected, 66, lost 15, and 51 recovered, with the case fatality of 22.7%. So you're following up on those survivors, and they're also making sure the humans and those people in mining caves do not interact with these fruit bats. So these are the two prongs. We continue from routine surveillance, and we are also resetting and returning to normal, but it's not the usual normal. It's actually a new way of getting ready for any similar outbreak in the future. So I thank you and look forward to your comments and questions into this discussion. I pause here. Thank you, Dijo. Back to you.
Thank you so much, Minister. We are thanking Rwanda and also the Minister for the leadership to control this outbreak. I think now it's time for strong action from our side. If you go to the CDC website, cdc.gov, the US CDC is declaring that to date, there have been no reported cases of Marburg in the US. There have been no reported cases of Marburg out of Rwanda. And they wrote, as of the 21st October 2024, the risk to the US from the Marburg virus outbreak in Rwanda is low. What it means? It means it's time now for the US to lift the L3 status. Then Africa CDC today will send official note communication to the US government based on the evidence that we have and based on what is in the US CDC website to request to lift the L3 status in Rwanda. All of us will celebrate that as we are still struggling with Mpox, but we need to celebrate the success on Marburg. This success on Marburg is giving us lessons on how we can fight other outbreaks, including Mpox. There are a number of lessons we are learning from Rwanda that will apply for Mpox. This is officially our position as Africa CDC, and by Monday, we'll send this official communication, it will be sent tomorrow, but by Monday we'll communicate that to the media that Africa CDC officially is requesting the US government, based on the evidence, to lift now this L3 status. I will stop there and give opportunity to journalists, through you, Margaret, to ask their questions on Mpox and Marburg.
Thank you, DG. Let's take the first two questions. This is from Kumba from Gambia Daily. He asks, what are the potential risks of countries without Mpox and what measures need to be put into consideration? That's the first question. Let's take the second one. What do you think other African countries can learn from Rwanda in fighting the Marburg outbreak? We'll start with you, Honorable Minister, and then we'll move to DG. Over to you.
Thank you, Margaret. I think we are all learning. For every outbreak, we learn a lot, and we should be sharing this to do better next time. The first lesson is that we need to have diagnostic capabilities. We need to have a strong early warning systems, but also in our health facilities. Like the first case we talked about, we got to learn from ICU. Who ever thought this would be the case? Because we've been having the past Marburg outbreaks far in rural areas, and you could lock that area and save, protect the cities and big hospitals. But this was the other way around, the opposite. So I think the other big lesson is that when people put efforts together, Rwanda received really support from all over the world. Africa CDC team landed in Rwanda 24 hours since after declaring this. I don't know even how they got the ticket overnight, but that was the speed we needed. The same example is how we deployed vaccine from Sabin Vaccine Institute and our partners in the US, how it went so fast. Monoclonal antibodies, the antivirals that Gilead Africa CDC Rwanda and partnered together to get this very quickly. So I think the speed was something to highlight, and it has to be triggered by existing relationship partnerships and protocols. Because when you're going through bureaucracy on things that usually delay things, you not be able to catch up with the virus. So I think the remaining part will be how also do we use this opportunity to learn in the future. We encourage countries and systems to report any alert without concerns that this is going to be a problem that could lead even to travel restrictions, to being a victim of what you're reporting and doing. Because when it emerges from one place, it is a problem for everyone. So we should be able to support that country, that continent, when an outbreak starts. It's for us. It's not for a country to deal with it and we lock it and forget. So these are a few lessons I would quickly pick, but there are so many, and we will keep learning, especially from the data we will be sharing on the incubation period, on the spillover, and how the One Health is very, very important in our context.
Yes, Margaret, from my side, first, as the minister said, we are also learning from Africa CDC. Our new statute is clear about Africa CDC must respond to an outbreak when it's declared in a 48 hours period of time. And by landing in Rwanda in about a few hours after the declaration, we think we are thanking our leaders who gave us an opportunity to be more autonomous and not to face the bureaucracy of AU, African Union, to respond to an outbreak. This one, in addition to others, to other response that we are providing to Mpox and other outbreaks, it's making Africa CDC fit for purpose on our mandate. Regarding the potential risk of other countries to be infected, yes, if you see in our Continental response plan, we listed affected countries at that time, they were 16, and we listed also high-risk countries. But anytime, any country can be affected because we are talking about movement of people. We are talking about other factors that are intervening. It means for us today, the risk is high for so many other countries to be infected. Over to you, Margaret.
Thank you, DG. Let's take the next two questions. Helen from Start News, you have the floor.
Thank you very much for doing this, and thank you for taking my question. This is for the minister from the health minister from Rwanda. I think I heard in the interview that you did with the New England Journal of Medicine that you believe that the first case, the minor, was infected in early August, which really pushes back the timeline for this outbreak. In any Marburg or Ebola outbreak, there are often probable cases, people who were infected but not tested when they were sick. Often those people are dead and can't be tested. I don't think I've heard anything about the number of probable cases in this outbreak. Can you give us some, can you shed some light on that, please? Thank you.
Thank you. Let's take the next one before the minister comes in. Carmen from Politico, you have the floor.
Thank you, Margaret. Also a question for Rwanda's health minister. What's the timeline now to officially declare the outbreak over? Is it 42 days without any new confirmed case, or is it another criteria? And did I understand correctly that you said that the index case is still alive, but the wife and the baby were dead? Just wanted to get that clear. Thank you so much.
Thank you. Over to you, Honorable Minister.
Thank you very much. Thank you, Helen. Let me start with your question. Yes, that's correct. We traced back the where we believe the first index case was exposed. Of course, it's hard to get that exact time, but that is somewhere in August, because we with the different incubation periods and the time we declared this virus and we tested it in September, that is the timeline we built backwards. And what made us believe that this is indeed our index case, we conducted serology testing, antibody testing to the minor. And it was actually true that he was exposed, and where he works actually in that specific mining site. There's a specific tunnel. There's a tunnel within the site, is known as Tunnel 12, where he works, and where we also found that a few of their colleagues, I think about 3 or 4, had also antibodies that there has been an exposure to the bats in the past. It's hard to determine the time, and these are what you're calling probable cases. And we're following up on that. Actually, we are extending our search in other sites, but these are only a tunnel, and this is an only specific mining site. We found these indications that an exposure has happened to our index case. So to Carmen's question, yes, it's true that unfortunately the mother and the baby passed, and that the index case is still alive, the man, and we have been actually following up him on different aspects, including social and mental support. As you understand, this was too heavy on him in a short time. So when do we declare the end of outbreak? Let me use WHO guidelines, which says after you discharge the last patient, which happened for our case almost. That was on the almost a week ago. Yeah. So we have to count 42 days. These are 2 incubation periods. That is what World Health Organization. That's when the World Health Organization will declare the end of the outbreak. In our context, has been 2 weeks without any case. Has been a week without after discharging the last patient. But looking at the contacts we've been following, all the exposed contacts, or the people who have ever had any link with any positive case, we are actually closing everything. Tomorrow on Friday, we will discharge the last contact or the last probable contact in our context, which means treatment center has already been closed after the last patient discharged. And we had to follow the few contacts that we remained in the pipeline. So that is the situation. And if I had to provide additional details, I'll be happy to do so. Thank you.
Thank you, Honorable Minister. Let's take the next 2 questions. This one is for the DG. Caroline from BBC asks, we know that WHO is set to convene an emergency meeting on Mpox on November 22nd to determine whether Mpox remains a global health crisis. If WHO meets and decides that Mpox is no longer a global health emergency, what does that mean for Africa? Let's take the second one. This is from Anite. He asks about Japan's Mpox vaccines. When do you expect a delivery, or when may you be able to start using them? And what issues are delaying delivery? Over to you, DG.
Thank you so much. Caroline, declaration of an outbreak is not just a political declaration. It's based on scientific evidence that we have. And the scientific evidence is coming from independent experts who are sitting in the emergency consultative group. For us to declare Mpox as public health emergency of continental security, we are guided by this group of experts. And as we said, from that declaration, they made twice virtually, and the last meeting was the physical meeting last week from Thursday to Friday. Their conclusions, based on the evidence that we have, their conclusion is clear. Mpox is not under control in Africa. Now, to respond to your question, if WHO IHR committee could advise the Director General WHO about the Mpox not being a global health emergency, public health emergency for international concern, based on the analysis from the ECG, I'm sure they will still continue to say that Mpox is a major public health issue in Africa. I think this is, I don't know what will be the conclusion, but at least what I know, Africa will remain a major issue for Mpox, and they will follow what our ECG members are advising. About the Japanese vaccine, let me hand over to my colleagues, Dr. Ngashi and Chanel, who are working on daily basis with the DRC government and Japan to see how everything will be possible. Dr. Ngashi and Chanel, over to you.
Yes, thank you very much, DG. We've heard from the Japanese representatives that the vaccines should be available before the end of the year. They have repeated that more than once. I think one of the key challenges that are left is the issue of liability. As you know, that every time that a new vaccine is introduced in the country, somebody has to sign for the insurance to be able to take care of possible side effects. I think that's the issue that is now being discussed with the Japanese government to find, I think, someone who would then take that take care of the liability issues. I think that's the only issue that is left now. But otherwise, everybody just looking to Japan to see to get the date as it has happened with the MVA vaccines. Over to you.
Thank you, Dr. Ngashi. Let's take the next two questions. Helen from, this is Kerry. So Kerry from Health Policy Watch, you have the floor.
Thank you, Margaret. My question is about the new PCR test for, developed by the Moroccan company. Do you have any idea what the cost of that is per test and how that compares to the cost of the Gene Expert test? Thank you. That'll be for the DG. Thank you.
Thank you. Let's take the next one, John from Radio Pan-African. You have the floor. John, can you hear us? John, can you hear us? Okay, let's cross over to the DG for the response. Over to you, DG.
Thank you so much. We have our expert.
Allô, est-ce que vous m'entendez?
Oui, John, on vous attend. John, on vous attend très bien. Okay, then let me hand over to Dr. Yenyu, who is our director for Lab Network, who did wonderful job, who coordinated this work with Morocco, and who managed to bring the Diagnostic Advisory Committee together to make the decision. Dr. Yenyu, can you please provide answer to that question from Kerry?
Yeah, thank you for
attendez.
that question. So the cost is $6 per test, very comparable with kits that are coming from Korea and China. But Morocco also gave us an offer if we can buy in large quantity, so they can bring down the cost to $5 per test. And as compared to Gene Expert, so this is very, very cheap, even twice cheaper. Huh? Thank you.
Thank you. This is a testimony that when Africa is doing local manufacturing, it won't be every time more expensive than what is coming outside. Because Morocco is giving us a better deal. As Africa CDC, we decided, based on the recommendation from our ECG and our governing board, to make these tests the priority in Africa. We'll procure that, we'll supply to African countries, and we'll also advocate for African countries to procure this test. I think that one is a major success for Africa, and we are celebrating that. Over to you, Margaret.
Thank you, DG. Let's take the next question from Ayele Africa News Channel in Ethiopia. He asks the cross-border collaboration, given the potential for regional transmission, how is Rwanda working with neighboring countries to prevent Mpox spread across borders? And the second question is, what measures are in place to ensure patients receive compassionate care and are not discriminated against? Let's take the response from the Honorable Minister. Over to you.
Thank you. Those are very important questions, especially the last one about those people who recovered from this outbreak, particularly Marburg virus disease, need to be actually helped, integrated, and supported. free from any discrimination and stigma. We have a full program to ensure that throughout this period, where they will be going back into their routine services, community, and everything they have been doing is without any discrimination. So that is important for us, but also something we are telling the community through our communication channels that they should be integrated and helped. But also we don't forget that they are survivors of Marburg virus disease or any VHF, viral hemorrhagic fevers, could still have some virus in some parts of the body, such as in semen for men, and also in the eyes for some of them. So we are also conducting these regular testing follow-up. We have an entire protocol. We have a team working on this. And this is also in the context of preparedness and make sure those who recovered do not be again starting another outbreaks in case some risk exposure happening. So we're balancing both, and is an important pillar of what we continue to do with our partners. So regarding what we do with countries, with the region, I think this discussion is part of it, and Africa CDC convening us and make sure countries affected by Mpox, because there are more countries in the region. Actually, it's not just Rwanda, although it started within the neighboring country, and we are on it together. So that's why it should not be a program of a country. It should be something the continent is looking into in the world. It's a global concern. So that is important to mention, to highlight. So there's already have a group of countries we share borders that was convened, created with DG Africa CDC when we met last in Brazzaville for our follow-ups. We share information. And also share experience and expertise now that Mpox is moving towards more of a ring vaccination. That is a tool we didn't have by then, and we should emphasize the importance of vaccinating all contexts whenever you have a positive case, and the treatment protocol we're using. But now we're talking about a new testing capabilities that is coming from the continent. So this is a big step made, and we should continue this way. Thank you.
Thank you, Honorable Minister. Let's take the next question. John, if you can hear us, you have the floor.
Oui, merci. Merci. Oui, merci pour la parole. La première préoccupation que j'ai, c'est d'abord saluer les efforts de CDC Afrique pour son attention vis-à-vis du Rwanda et de la RDC à travailler à endiguer l'épidémie du Marburg au Rwanda et celle du Mpox en RDC. Néanmoins, j'aurais posé la question au directeur du CDC Afrique, le docteur John, pour savoir pourquoi, lors de briefing organisé par CEFIA, par CDC, auquel nous participons maintenant, ils ne prennent pas l'initiative d'appeler ou d'inconvier le ministre de la Santé congolais pour nous expliquer l'évolution de la maladie. La deuxième préoccupation, je voudrais juste savoir est-ce qu'il existe aujourd'hui un bulletin quotidien qui relaye les informations succinctes sur l'évolution du Mpox en RDC? Si on n'a pas, alors je vais recommander à Africa CDC de rendre disponible via ses services de communication un bulletin quotidien que nous pouvons consulter régulièrement, soit sur le site de Africa CDC, soit via notre plateforme qui nous unit et dans laquelle nous partageons suffisamment d'informations. Et je vais aussi poser la question. J'ai entendu le directeur CDC dire que le CDC va entrer en contact avec le gouvernement américain pour lui demander d'extraire le Rwanda sur la liste des pays à haut risque pour contracter le Marburg. Je voudrais savoir si une telle initiative ou une telle demande intervient après combien de temps après la fin, donc après la déclaration de la fin d'une épidémie dans un pays. Merci beaucoup.
DG?
Yeah, so many questions then. You didn't want to take a second one. Okay, the first one. Bon, en français, puisque vous avez posé la question en français. Africa CDC a un protocole quand il y a des épidémies. Quand l'épidémie est au niveau national, c'est le leadership du gouvernement. Quand cette épidémie déborde le pays et maintenant au niveau de plusieurs pays ou de la région ou du continent, ça c'est le mandat d'Africa CDC de venir gérer. La raison pour laquelle nous sommes avec le ministre du Rwanda, et comme vous avez dit que nous félicitons, c'est puisque Marburg est contenu au niveau du Rwanda. Si jamais Marburg avait dépassé les frontières du Rwanda pour être dans d'autres pays, ça aurait été le mandat d'Africa CDC de gérer cette épidémie qui peut avoir des conséquences sur non seulement la région, le continent, mais aussi le monde. Le ministre de la RDC, comme le ministre de Burundi, comme le ministre de l'Ouganda, comme le ministre d'autres pays, vous suivez nos points de presse, il y a plusieurs pays, 19 au total affectés. Nous n'avons pas voulu individualiser cette question. Ce n'est pas seulement la question d'un seul pays, c'est la question de plusieurs pays sous le mandat d'Africa CDC. C'est vrai, nous allons de temps à autre inviter les ministres de certains pays qui sont affectés pour nous dire les réalisations, mais aussi les challenges. Donc, pour le moment, c'est ça la logique pour que vous puissiez comprendre. Alors, par rapport au bulletin, l'équipe de réponse qui est même basée en RDC pour le continent est en train de travailler avec les communicateurs en santé. Ils sont en train de publier régulièrement des messages, mais ils ont entendu votre requête et s'il y a une action à prendre pour renforcer le volet communication, comme vous le dites, ils n'hésiteront pas à la prendre. La dernière question sur combien de temps on peut prendre pour que notre initiative d'écrire au gouvernement américain puisse être faite, je dois rappeler qu'il y a deux concepts différents. Le premier concept, c'est le gouvernement américain qui a mis en place un niveau 3, level 3, niveau 3 d'alerte par rapport à l'épidémie de Marburg, puisqu'il y avait des craintes que le Rwanda infecte les États-Unis. Cela n'a rien à voir avec la deuxième notion qui est la proclamation de la fin d'une épidémie. Aujourd'hui, comme le gouvernement américain, à travers les sites de CDC, a déclaré que la possibilité pour les États-Unis d'être infectés est faible, donc ils peuvent lever cette mesure alors que le ministre travaille selon les protocoles convenus avec l'OMS pour déclarer la fin de l'épidémie. Donc, ce sont deux concepts différents. Et nous disons au gouvernement américain, il n'y a aucun risque qu'un Américain aux États-Unis soit infecté par le virus qui viendra des du Rwanda. Donc, il faut lever cette alerte de niveau 3. Voilà à peu près l'explication pour ces deux concepts. Back to you, Margaret. I hope my French is still good.
Thank you, DG. Let's take the last question. David Njagi from DVEX, you have the floor.
Yeah, hello. Thank you for this opportunity. I just want to ask Africa CDC, okay, we are facing a pandemic and we are facing an outbreak of diseases. And African researchers are saying that, there's hope in African medicinal plants. I don't know, what is the position of Africa CDC in terms of, our own researchers going by what happened at COP16, that we have the potential to develop our own, cures. Yeah. What is your position about the potential of African medicinal plants, coming in to fight these disease outbreaks?
Thank you very much. Let's take the last one. This one goes to the DG as well. With 65% of confirmed cases of Mpox in Burundi being adolescents or children based on the last UNICEF report, what progress is being made with regards to ensuring they begin receiving the Mpox vaccine? That's from Naomi from Capital FM in Zambia. Over to you, DG.
Thank you so much. We have a strong team led by Dr. Mosoka working on research and development and science under the IMST. Dr. Ngashi, I don't know if Mosoka is connected. I will hand over to you and Mosoka to answer the first question. While you are preparing yourself, let me quickly answer the second one. Yes, Africa CDC is supporting all countries, including Burundi, to respond to this outbreak. We positioned a number of epidemiologists, lab colleagues, lab people, and data manager, and so many other skills to support the response. We are led by the policy of each country on the way to use vaccine now or later. I think for now, Burundi is doing a great job in terms of mortality because since the outbreak started, we have 0 deaths in Burundi. But we need to continue to support the country, and we'll be ready when the country will alert us that, will inform us that they are ready to introduce the vaccine. For now, we are talking with the country and we remain open when the country will be ready for vaccine. Over to you, Dr. Ngashi, for the first one.
Yeah, thank you very much, DJ. I think just to reassure David that Africa CDC convened a joint meeting with WHO that gathered more than 2,000 researchers. I think all our African researchers came together to define the research agenda for Africa on this Mpox outbreak. Out of that, they identified the 10 research questions, I think, that are there. They also listed 48 studies that are already ongoing, and they established a partnership on research for Mpox, and also released a research roadmap for Africa. I think those African researchers are the ones that are gathering, all the solutions, all the medical countermeasures, confirm that we are very much led by science, we are very much led by evidence. We have a group of African experts that define what product goes into the pipeline for research, to be able to look at the safety of the product, and also the efficacy of the product. I think that process is ongoing. Now, when it comes to traditional medicine in particular, I think I cannot say that we do have an agenda for now, but I think those are still areas that can be, explored as we move forward. But the research agenda is being established by a very strong team of experts. Over to you, DJ.
Back to you, Margaret.
Thank you very much. And with that, we have come to the end of the briefing this week. I'll hand it over to the DG for his closing remarks, and the Rwanda Minister as well, Honorable Minister, for any closing remarks.
Let us start with the Minister.
Thank you, DJ. Mine is to thank you and to thank our colleagues from media and other partners who have been on this weekly. And I think the communication being shared is also a tool to fight the outbreaks. So I've realized that actually it's probably the most important one when you provide the right information, the right time, and with facts and consistently, you can reduce the pressure on other pillars to respond to the any outbreak, including Mpox or Marburg virus disease. So I want to take this opportunity to appreciate that our communication at Africa CDC with everyone who has really coming here every week has made a huge contribution to the progress we are making, and this should continue. So we'll be happy to join next time whenever we are invited for this and even for other health issues on the continent. Thank you.
Thank you, Minister. We are so grateful that you can dedicate your time, despite your busy schedule, to be with us on a weekly basis. From our side, this week we are celebrating good news while we are also facing some challenges. As you saw, good news first, we can say Rwanda is out of Marburg. We are just following the protocol, but we are crossing our fingers that there will be no new case. Second, we are celebrating also this success from Morocco regarding the manufacturing of the PCR kit that will be now distributed to all African countries. A number of challenges. Mpox is not under control. We need to increase the support to our countries. We are again calling our partners to see how we can come together to support for the response. And we are also calling for our own countries. And let me inform you officially, and member of the media, you'll get that President Kagame sent a letter to all African leaders and private sector for a meeting that will take place on the 14th of February in Addis Ababa on the margins of the AU Assembly to discuss about health financing in Africa. This is an opportunity for our member states to come together to commit funds for the health system and for Africa CDC, but also our partners to come for a comprehensive program that we need to have. The last point is about the letter that I will send, and you'll get the copy on Monday to the officials from the US with all evidence that we have to lift the status. With that, we believe that next week on Thursday, we'll have more to share with you on all of these developments that we are discussing today. Thank you so much. And let me wish all of you good night, good evening, good afternoon, and we'll meet you next Thursday.
Record.